Hey everybody, this is Eric Banter and this is Dr. Amy Banter. And I know in our last video we were sharing with you what we're doing and why we're so excited to be doing this. Today is more about who does this benefit. And Amy, you have an amazing vision for OPT2LIV Medical. Can you share with everybody why this is for everyone?
Sure. My 26 years experience as a family doctor, I think the one thing I know for sure is that we have to have a proactive approach focusing on disease prevention, health promotion, and that's really the whole goal of OPT2LIV Medical.
So, and if we look at the population of people, I know the Centers for Medicare and Medicaid Services focus in on 4 categories. You're either well, low risk, that's 1 stable condition, rising risk, that's 2 or more stable conditions, and then a high risk are the unstable conditions, right? Mm-hmm. And if we look at the population of people, this is 30%, 35% low risk, 30% rising risk, 5% high risk. But if you look at the costs of this, the first 2, well and low risk, represent 3% of the cost of our healthcare. And then the last 2 are 97% of the cost of healthcare, with the 5% high risk half of the cost of our healthcare system. And so I know what you have been seeing, and again, the Centers for Medicare and Medicaid Services, we know that 18% of the rising risk move to high risk every year. And so there's a progression across our healthcare system today for people to get kind of worse. And what I'm so excited about with the OPT2LIV Medical model is that you're driving people this way. Do you want to share with us, how do you do that?
Well, again, just to reiterate what you're talking about, right now, our healthcare model, they call it, is really a sick care model, right? So we're focusing all of our money, our time, our energy, our efforts on these sick people. And so we really want to shift it. Right now, you go to the doctor maybe once a year for your physical. The rest of the time, you go if something's wrong, if you're sick, if you need something. So we want to make this more of a proactive approach. We are going to be reaching out to our patients. We're going to be monitoring people. I'm a board-certified family medicine doctor, but I also have done a lot of training over these past 26 years in integrative medicine, functional medicine, and there is so much science out there showing what it takes to be well, to age, to prevent disease. And you don't go overnight from well to sick. We know that. It usually is something brewing. It can be for weeks, months, years. And so we're going to reach out to you with some really a lot of data and look at parameters that we can help you and give you feedback to keep you in your optimal state of health and on your optimal path towards healthy aging.
I love it. So if this sounds right to you, go to OPT2LIV.com. That's OPT, the number 2, LIV.com. We would love to be on your journey of optimal living. We hope to see you soon.